Hey everybody, I'd like to take a couple minutes to talk about oral potassium preparations, particularly in regard to older patients that have difficulty swallowing, especially patients with dementia. But really, this may be helpful for anybody or any patient that you're caring for that has difficulty swallowing. My dad takes care of my mom, who has pretty severe dementia. And they've been taking K-tabs, which are potassium-coated tablets that you can't really crush. If you do crush them, it tastes horrible. It's disgusting. So the options are liquid. I think it's called KSL. It's pretty expensive at the pharmacy, very likely to run into insurance issues, possibly prior authorization problems. It's also a considerable volume to consume, and the patient may not care for the taste of it. Another option is the powdered potassium. It comes in little packets. Again, it's pretty expensive. I think it's probably more likely to be covered than the liquid. It does come pre-flavored as well. The patient may or may not care for it. The next option is the Klor Con tablets. They come in a wax matrix. My mother had been taking this in the past, but what happens is, the tablet is so big, especially in the 20 milliequivalent per dose, that really nobody should be trying to swallow it. It's very sharp and very large tablet. And so we used to put it in a liquid, like just some water, and the wax matrix, it'll break down and you can actually take it that way, but it always leaves a little bit of the slurry there at the bottom. And so patients are concerned that maybe they're not getting it all, which could be true. I don't think it tastes very good either. I don't recall if I tasted it, but it's likely it probably just tastes like a salty mess. Then another option, which I think is probably the most ideal for most people, is the capsules. I can't remember the name offhand, but I'll show it in the video. So anyway, they can be opened up, and the little pellets in those can be mixed into food or even put into like something as small as a teaspoon of pudding or some chocolate thing or something they'll like, and quite easily also given to somebody perhaps like on a G-tube or something. Just shake it down the line, flush it. So I think that probably capsules are going to be the best option. They're very cheap as well. You're unlikely, just like with Klor Con, to run into any issues with insurance. So, all right, well, thanks a lot for watching, and see you another time.